So tonight I'm just gonna go ahead and vlog how our night goes. So tonight we have nursing, but she doesn't come until 3 a.m. So I'm gonna go ahead and show you how our night goes. Should be kind of chill, not a lot happening, but we'll show you anyway. So we're starting to keep an eye on her pulse ox here a little bit more. I mean, we always do, but her heart rate is starting to stay lower. As she gets older, the heart rate will stay lower. And right now her parameters are set to where it'll alarm if it goes below 80, which is, this is her heart rate, this is her oxygen. So if this goes below 80, it will alarm, just telling us that her heart rate is really low, but they said that that's okay, that we just keep an eye on it, and then when we call pulmonary, and she likes to keep us on our toes. So I don't know if you can see me or not, but I'm currently laying on the floor of her nursery with her pulse ox right there, keeping an eye on her because it's freezing in here. She likes to be cold. Her temperature, I guess, she likes to stay in the, like, anything higher than like 73 degrees, she is like, I'm too hot, it's too much. So we keep her room at 70 degrees all the time, which is enough to make me frozen. All right, so it's dark in here, but it's only 6 o'clock at night. So she was napping, her whole day schedule got messed up, but we still have to do all of her bath time stuff and everything. So we just started her 6 o'clock feed. There's her pump. So I'm gonna go ahead and wake her up. I know, don't wake a sleeping baby, but we need to. She has some eczema and we have to really clean all of that out. So we're going to do that, and yeah, I'll show you her nighttime routine. All right, so I'm going to go ahead and turn on the lights. Oh, there we go. Oh my gosh, you should see her here. Hold on. Baby girl. See all these little dots? It's her eczema and heat rash and things, so we're trying to make that good. But I'm sorry, baby, well, we gotta wake you up. I'm gonna put her on a sprint. So this is her HME. I'm just gonna go ahead and put it on her and disconnect her from the vents, and she's able to sprint for a little while, and makes baths a lot easier when we get to use this versus having her connected to the vent. Who is that baby? Oh my goodness. See, who is that baby? You ready for bath time? Are you ready for bath time? Say, hi, ready for bath time. Oh my goodness. Say, let's go. Mwah. I know. Wow. So we have this, and it's set up on the second setting so that she can sit up in it. We have a little stingray that tells us the temperature. Pulse ox is making noise for no reason. We use Johnson & Johnson's right now. That's what they use in the hospital, so that's what we're sticking with. Just make sure that it's nothing that we have that's going to cause her like a skin reaction, that she'll be comfortable in that. We're also going to be doing her strings and everything tonight. So we do a bath every other night, and we change her trach ties or strings, whatever you want to call them. And so we get them pretty wet because we use this to rinse out her hair because of her trach. We can't like just put her in water. So we have to be really careful about it. And so we'll show you all of that here. All right, so I'm just switching over to a voiceover here. So this is just us washing her hair and snuggling her after her bath. We're gonna go ahead and do her cares here. So this is just a little box that we use to store all of her materials. So we have non-stick pads, Q-tips, Mepilex, the tape, extra button buddy things for her G-tube. So yeah, we have the sterile cotton swabs, Mepilex, that's the Mepitac tape, and then the Mepilite dressing. Strings are there on the right-hand side. And then here on the left is all of her G-tube and extra tape and things. So this is what we're going to go ahead and do. So we're taking out her Mepilex here, and this is just, we left it in for her bath so that way it could capture if any water accidentally got near her trach, it would absorb any of that moisture. So we're taking that out now so that we can replace it. And then we'll sit her up. I'll hold the trach, and Daryl's going to go ahead and take out the strings or disconnect the strings here, so this way I can secure and hold the trach in place while we replace the strings. So he's going to go ahead and detach those, then he's going to grab some gauze and he's just going to dry her neck really good. You don't want it to be all wet and have excess moisture in there. It's just, you're asking for trouble if you do that. So we just dry it out really, really good before we go ahead and move on to the next step here. So he's going to finish drying her out. Then we lay her back down And he goes ahead and grabs the new strings for trach ties, and I'm sorry that the camera kind of gets in the way of the camera there, but so I continue to hold the trach, and I just support Lena's head a little bit so that he has better visibility and accessibility to everything. So he's going to go ahead and disconnect the old ties and connect up the new ones. And I'm just going to fast forward this a little bit because it does take a little bit of time to do this. And once they're connected, we go ahead and sit her up, and then he goes ahead and connects the strings in the back. That way that they're nice and tight and hold the trach in place. And then once that's done, he lets me know that they're clear and we're good to go. Lay her back down. So the next thing we're going to do here is just her trach care. So I did speed this up a little bit too because it does take some time, just like everything. But we just use the sterile Q-tips and water, and we clean out anything that might be around her stoma, like secretions and things like that. And then we go in with some dry Q-tips and we dry out all of that area for the same reason we dried her neck. You just don't want there to be any extra moisture in there. And just making sure it looks all nice and clean and healthy. And yes, I use a ridiculous amount of Q-tips, but we're still trying to make sure that she's safe and home. And since she's been home only for a couple months now, we're just still really cautious. And then I'm going to go ahead and put under her dressing here. So we're using Mepilex. We do switch between multiple different types of dressing depending on how her skin's reacting. But right now it's just Mepilex. It's a foam dressing that has like a sticky backing on it. And then this extra dressing that I'm about to put in here on either side is just because her skin's currently reacting. And so we're not sure if it's to the strings or if it's to something else. So we're putting this there so that way we can put it as a barrier between her skin and the strings without it being any kind of like moisture, creams, anything else that she might be reacting to. So we're just testing that out here. All right, and this is what her trach looks like after it's all clean and all dressed up. And then we did her G-tube too, and we just put the little button buddy on there. He's so cute. And here we're just putting on her pulse ox. So we take it off for her bath because it doesn't really work well with water. So we take it off, we're putting it back on, and this is just the thing that reads her heart rate and her oxygenation and just making sure that she's doing good. The whole time we're doing her bath, we're monitoring her, and so we're able to see kind of if she has any visible changes to like her skin or how she's breathing and everything. So once I have her all hooked up here to the pulse ox, I go ahead and turn on the machine. It blinks through all of its little stages here. It takes a second to turn on and then to pick up a reading. And then we just do some little snuggles and hanging out before bed. She's doing a sprint right now, so that means she's having some time off the ventilator. So we're just trying to get her through the final part of the sprint before we put her on. And that's what you're going to see here in the next clip, is us putting her back on the ventilator after her sprint. All right, and then her feed is done running, so we go ahead and turn off the pump and disconnect the feed bag and pull it out of there. That way we can go clean it out. Now we just go ahead and turn off the lights, make it nice and dark, turn on her little night light. It does this really cool thing on the ceiling, and so it's just kind of our signal, okay, it's time to go to bed now. I then go ahead and just start cleaning up everything that's on her dresser. So this is just putting away her meds and her syringes. This is just kind of cleaning up, Clorox wiping everything, just reorganizing and cleaning up. After doing all of her cares, we tend to make a giant mess of the nursery. And so we just kind of have to take that time to go ahead and tidy everything back up and get it looking nice. All right, and here I am rinsing out her feed bag. So since it has some extra formula and things in the line after her dose is completed, I just come into the bathroom, we rinse it out with some really hot water. You fill it out and rinse out the bag a couple times and then empty out the lime. Then I come back into the bedroom and I just wipe everything down with an alcohol swab because, as you saw, I was in the bathroom and I'm just germaphobe. So after rinsing everything out, I just kind of wipe everything down with alcohol and making sure that it's all clean for the next time that we have to use it. And once it's done being cleaned out, we go ahead and store it into the fridge. And that's just to make sure that if there's anything that's left in there that is kept refrigerated, that way she doesn't accidentally end up with anything like any formula that's stuck anywhere. Now it's after 7, so that means her feed's done and we're just gonna go ahead and snuggle. So I'm laying on the floor of her nursery right now because we have to stay awake with her at all times. So I'm just laying here with the dogs. I'm gonna go ahead and watch some Netflix. And I think I end up watching Grey's Anatomy. Yeah. So then I just sit here and I monitor her with her pulse ox next to me and we just lay here. All right, so it's 10:30 now. I had gone downstairs and made all of her feed. So we load up her fridge here with all of her bottles. Yeah, you can't really see it, but I pre-make all of her feed for 24 hours and then I put it all in the fridge. That way it stays cold and is like follows the instructions and stuff so that they're all okay and to continue to use. That way you don't have to mix up individual bottles. That's how our dietitian has us doing it. So I did all of that. I also jumped on a mommy call thing. So I'm a part of a Trach mom group and we had like a mommy night or a girls night or whatever. And so a whole bunch of us just hopped on a conference call type thing and sat around and talked and kind of shared our stories and shared all of that. So if you guys want a more in-depth kind of video on like Lena's story, my story, her birth story or anything like that, let us know. We can definitely do that. There's a lot, so I won't do it here. So it's 10:30, we're gonna do that and keep going here. I tell because I've drank most of it is a coffee because I still have to make it to 3 a.m. So thank you to him for that, doing that. Oh, I was gonna show you him, but he just left. He's back. He went and got us food. And then he went into the bathroom when I was trying to show you the food. So he's here. He's a good one. He's a keeper, I guess. Oh. Watching Grace, still about to pump. So here we go. So as I lay here on the floor, I'm still able to see her and monitor her. She's stirred up a little bit, so my husband went up and changed her pulse ox. You have to move it every couple hours. So he moved her pulse ox, took advantage of that, changing her diaper, all of it while she's still awake. All right, so it's midnight and my husband just put up Lena's feed. So at midnight she gets a new feed bag because the bags are only good for 24 hours. So she got a new bag and we're gonna go ahead and give her some potassium. She gets potassium every 6 hours because of the other medications that she's on. She needs the potassium to make sure that her heart and stuff goes well. So we're gonna give her the potassium. We have to wait for her feed to go for a little bit before we give it to her because it can upset her stomach. And then after midnight, it's smooth sailing. We don't have anything. She doesn't have any feeds, any meds, or anything like that until 3 a.m. So you'll just hang out with us. So if you've never given meds through a G-tube, you do have to pause the feed first. Otherwise, you'll end up with feed coming out the med port. So you pause the feed and then you go ahead and clamp. You open up the med port, you plug in the syringe, and then you push the medication through. And then you reclamp and start the feed back up. Go sleep, baby. Go sleep. And then I just continued to hang out on the floor with the dogs and snuggle here. Just watching her, making sure she's doing okay the whole time. My husband likes to play Among Us. I like to watch Netflix. It's just, we need multiple things to keep us awake and keep us occupied and just to pass the time. All right, so it's 1 a.m. Lena's midnight feed just finished. So I'm coming downstairs. I'm bringing down like our ketchup and stuff because we had lunch upstairs or dinner. Now I'm gonna go ahead and let the dogs out. I know it's 1 a.m., but our nurse will be here at 3, and this way that they can just kind of be left out, run off a little bit of energy. So maybe they won't bark at the nurse whenever she gets here. That's wishful thinking. They definitely will bark at the nurse when she gets here. Yeah, so I also have to take my meds. I really am open, and my kitchen is a disaster. Don't even look. But I'm really open about mental health because I think it's super, super important. And so I just want to reiterate, as I've said in other videos, check on your mom friends. Make sure they're okay. Make sure they're doing good. Postpartum, or whether they have a 5-year-old, 7-year-old, a 3-month-old, whatever it is, check on them. Because postpartum, anything is real. Anxiety, all of this. So just check on your mom's friends. Also, I take a ton of vitamin C. I mean, not a ton, like I take the recommended dose, but I make sure that I have that. I also occasionally have this, it's elderberry airborne gummies. It's just to support your immune system. With Lena, we just try to make sure that we take all the precautions possible. So we try to protect ourselves as much as we can. We don't really go out right now, but it's just a way to make sure that we extra protect ourselves. That way we don't bring home anything to give to her, or at least limit how our bodies handle that. That way maybe we can fight it off before it gets to her. But yeah, so I'm gonna go ahead and take my pills and then take let the dogs back in, feed them, and then head back upstairs. I'm just waiting for the dogs to finish eating. Shut off the lights and I sat up here. That way I can make sure they don't get into anything before heading back upstairs. And so yeah, but like I said, it's 1:15. So we have a little bit till our nurse gets here, but it's pretty much gonna be chill. And yeah, there's the dogs ready, so we're gonna head upstairs. I'll show you a clip here of how she's sleeping. We put her in and she just moves however she wants to. And it's kind of funny because like with the trach, it doesn't really stop her. She does whatever she wants to do, however she wants to do it. So this is her board. And so the nurse is about to get here. It's about 2:30. So I'm gonna go ahead and update the night shift to have all of her data. That way, in case I miss anything for giving the nurse report, it's already here on the board. All right, so it's 3:15. Our nurse just got here. We gave her a report, told her what was going on with Lena, talked just a second about how she's doing and stuff like that. Went downstairs, got myself an ice cream because treat yourself, right? So now we're just gonna go to sleep. I'm probably gonna turn on TV just to give us something to fall asleep to. Also, if you don't already, I don't know where it went, but if you don't already have like a sleep mask, like one of those things that goes over your face and you sleep and makes it all dark and stuff, get yourself one. It helps you sleep, especially when you're up late like this. So if you're up at 3 and then you go to bed, you're up until 3, then you go to bed and you want to sleep in a little bit later, get a face mask. That way you can keep it darker longer. You can sleep in later. We also, excuse me, I have the hiccups now. We also use them whenever we go to bed earlier to try to like prep for these nights. So if we go in like 6 while my mom's watching Lena or something, those are super helpful too. So get yourself one if you don't. Super cheap off Amazon. So I'm gonna go ahead, watch some TV, eat my ice cream, and go to sleep. So thanks for watching. Have a great day.